Nurses educate patients and family members on a daily basis. If you enjoy teaching, you may want to explore opportunities in clinical teaching, which occurs at the bedside or in the community where nursing practice occurs. This video provides an overview of different pathways that you can take if you're interested in clinical teaching, along with exploring the advantages of being involved in clinical teaching. There are two major pathways to clinical teaching. One pathway for clinical teaching occurs while working at a clinical agency. Precepting students and new nurse residents would be examples of this type of clinical teaching. Another pathway to clinical teaching is working in an academic setting for a school of nursing to teach small groups of students in the clinical setting. The first and most common role that most nurses find themselves engaging in clinical teaching is that of the nurse preceptor employed in a clinical agency. Preceptors are often used to guide and supervise nursing students, new nursing school graduates who are transitioning to the role of the nurse, and nurses new to the unit who need orientation, especially if they are coming from different specialty areas. When precepting nursing students, you'll work with faculty members to guide and supervise the student, providing learning opportunities consistent with their level of experience and course requirements. Sometimes nurses precept a student whose instructor is on the unit with their group of students, and sometimes nurses precept a student whose instructor is not on the unit, but available remotely by phone or email, and the instructor checks in to assess the student's progress. Preceptors are critical to maintaining quality and safety of patient care, while helping students learn how to be a nurse. Preceptors also work with new nurse graduates one-on-one for several weeks or months on a unit to guide and develop their clinical and professional skills and ready them to care for patients independently. Preceptors may show the new graduates how to perform skills, document the electronic health record, and organize their time while working through their competency checklist. Preceptors in this role are essential to help new nurses bridge the gap between education and practice. Preceptors are also sometimes assigned to nurses who are new to the unit or specialty area to help with orientation and transitions. For example, a nurse coming from the emergency room to an oncology floor may work with a preceptor for a short amount of time. A second clinical teaching role in the hospital is that of unit educator, who provides education and competency assessment for all of the staff on the unit or in a department. Unit educators identify policies or clinical skills that need to be improved and develop opportunities for the staff to learn. The rapid change in hospital environments and patient care requires that the staff be updated on new techniques and equipment. It's difficult for the busy staff nurses to keep up with the latest changes, so unit educators help staff maintain and develop their knowledge and skills, which helps improve quality of care and staff satisfaction. Lastly, an education department director in the hospital setting coordinates the efforts of the group of educators and may have management responsibilities. You can demonstrate your expertise as a unit nurse educator or education department director by taking a certification exam. The Nurse Professional Development Credential is used by many hospital educators. What are the advantages to clinical teaching while working at a hospital or clinical setting? First, preceptors and unit educators have a broader impact through teaching others than they would have by performing only their own patient care. Teaching others has a ripple effect. You are impacting the care of all the patients that those you teach cared for. Teaching others also improves your own knowledge and skills. You have to know something well to teach others. Many people enjoy helping others through teaching and find it personally rewarding. And finally, many teaching activities in your clinical setting will count positively at your annual evaluation and help you move up the career ladder. You'll want to keep track of your teaching activities as part of your professional and teaching portfolio. The second major pathway for clinical teaching is to work in an academic setting for a school of nursing. There are a variety of opportunities down this pathway. If you want to work as faculty for a school of nursing, the Texas Board of Nursing requires you to hold a master's or a doctoral degree, preferably in nursing, and demonstrate evidence of your teaching ability, clinical expertise, and current knowledge in the area you're teaching in, such as pediatrics or adult health. If nursing education is your passion, enroll in a nursing graduate program. You can pursue a master's or doctoral degree and gain knowledge and skills in your specialty area, as well as nursing education, scholarship, and leadership. If you're interested in pursuing a graduate degree to be qualified for a teaching position, check out our website or email to learn more about the admissions process, any prerequisite requirements, and costs. In addition to a graduate degree, knowledge and skills about teaching can be obtained through nursing education certificate programs, usually about 3 to 5 courses focused on teaching in clinical and classroom settings. Many nursing education certificate programs are offered online and do not require that you be enrolled in their master's or doctoral degree program to work on your certificate. Check with the individual certificate programs about possible prerequisites. After completion of a nurse education certificate program or individual study, you may want to test your skills and knowledge by taking a certification exam. The Certified Nurse Educator credential is valued in higher education settings. Clinical teaching positions, also called professional track faculty, can be full or part-time, and different schools have different teaching contracts. Some have 12-month contracts, some have 9-month contracts, and some have contracts by the semester or quarter. For clinical teaching positions, the position focuses on developing clinical competency in students. Clinical teaching can include didactic or lecture discussion classes, skills lab and simulation classes, and clinical classes in the hospital or other clinical settings, some of which may be precepted, like advanced practice clinicals, and some where the faculty take their group to the clinical site with them. At a college or university, a professional track faculty member may teach nursing students at all levels depending on their area of specialty and may have opportunities or responsibilities to conduct research, publish, serve on committees, and take leadership positions. The professional track includes pathways for promotion to higher levels with greater responsibilities and opportunities. Promotion pathways for professional track educators often requires a Doctor of Nursing Practice, DNP, or a Doctor of Philosophy, PhD degree. If you want to do research in teaching, there's a separate pathway called the tenure track that you may be interested in. Tenure track at research universities requires faculty to demonstrate their productivity in research, grant writing, and publication in addition to teaching. Faculty on the tenure track who do research are usually prepared with a PhD degree. Nationwide, there is a significant faculty shortage, which limits the number of nursing students that schools of nursing can accept. Being a nurse educator addresses the nursing shortage because educating more students creates more competent and licensed nurses. Orienting new nurses and teaching in clinical units provides nurses with the support and skills they need to provide effective patient care. Clinical teaching in both clinical and academic settings are vital to the delivery of high-quality health care. In summary, roles for nurses interested in clinical teaching are varied and rewarding. You can engage in clinical teaching at a clinical agency or a school of nursing, or both. This could be your next step in your career. We encourage you to take a step toward this role and make a difference. Please watch the interviews of our dynamic nurse educators to see different roles and opportunities that are available, and check out our clinical teaching toolkit.